Today class we are going to see the most important topic in unit 2, that is electrosurgical machine. So in this class we are going to see what is all about electrosurgical machine, how does it works, what is the operating principle of this ESU unit, and what are the different modes which is being involved in this ESU unit, and finally we will be also discussing and where and how it can be used. So these are the things we will be covered in today class. So let's start with the basic introduction of what is ESU, that is electrosurgical unit. So electrosurgical machine is one kind of therapeutic equipment where the high frequency current, that is electrosurgical currents, are used in order to cut or coagulate the blood vessels during surgical procedures. The reason is that here we are using high frequency current in order to make a precise cut with a limited blood loss. That is one kind of welcoming applications you can have in surgical procedures, because in surgical procedures they usually use surgical tools like normal knife and something, so that will lead to heavy blood loss. So in order to avoid this here, avoid or minimizing the heavy blood loss to attain the hemostasis condition, so we are going with the ESU unit, that is electrosurgical machine. It has the ability to make even very precise cut with limited blood loss. That is one of the main applications of this ES unit. That is why it is being used in any complicated surgeries performing in operation theaters. So you can see this particular machine in all kind of or all sort of operation theaters where the surgical procedures are very complicated, and there is a need to have a minimal blood loss. So that is the main importance of this ESU. So the if you take any ESU unit, that is surgical diathermy machine, we can be used for main four purpose or four application. One is to cut the tissue, and second one is in order to coagulate the tissue, that is blending the process, blending the cells or tissues in order to avoid the heavy blood loss. And third and fourth is one is desiccate and fourth one is fulgurate. These two processes to remove any unwanted tissues superficially, or to make the cells extreme dryness in way they are removing the unwanted tissues. So these are four applications or the purpose we can use a surgical diathermy machine. So that, and also there are two modes which is being involved in AAC unit. One is monopolar mode and bipolar mode. In the name itself you can easily guess it. One is monopolar in the sense here there will be one active electrode and another one is a reference electrode. In bipolar mode the electrode will have two active electrodes, that is the bipolar. There is no need of reference electrode here. That is the meaning of monopolar and bipolar. So these two electrodes lead system we can see in ESA unit. We will see the basic schematic diagram of surgical diathermy. So if you see the one block, that is nothing but ESA unit. It has like a different intensity control knob. Okay, so because in cutting and coagulation we will be setting different intensity, we will not be for use same intensity for all four purpose like cut, coagulate, desiccate and fulgurate. So each process we have different intensity control. So for this you have intensity control in ESU, that is one important parameters to be monitored and controlled. And two lead system is projecting out from this ESU unit. One it is being connected with active electrodes, another is being connected with the reference electrode. So this particular schematic diagram is representing monopolar method. Okay, so this pencil type of electrode is here acting as an active electrode, because it is the one it's making direct contact with your tissue where you want to make precise cut. And another electrode is plays an other hand, that is the backside of your body. This second electrode is nothing but a reference electrode, and you can also call this patient written electrodes or indifferent electrodes, because the main concept of the surgical diathermy is that whatever the current is being flowed, okay, you can see the path of the frequency current. So whatever the current is being flowed from the machine to the patient again has to return back to the machine, because if the current is not returned back into the machine, it is being when it is being stayed inside the body, and then it will leads to some side effects like all the organs, all the tissues tissues will get burn out or burst out. So ultimately it will end up with adverse effects. So that is the reason we have to create least current, least resistance path for the current to be collected and send it back to the machine. So that is the reason here we are placing the second electrode, that is reference electrode, otherwise you can call it as patient return electrode. So that you have to place the backside of your patient, so that whatever the current is being distributed through the active electrode, that all the current after doing the process of cutting or coagulation, it is being collected and returning back to the machine. So this is the current path. It has to be close the loop when we are doing any sort of purpose like cutting coagulation or using any sort of modes, monopolar, bipolar. So the thing is like the current flow has to be closed, else it will be giving to some other side effects like burning of tissues or cells. So this is the overall the operating principle. How does the current flows happening in monopolar method, right? So the same concept will happen for bipolar method, but where the different, that is the patient return electrode will not be there, because the single electrode will have the both thing, that is active electrode and reference electrode. So the current flow in between the tips of the electrode, so easily the one in one way the electrode will come, current will come, in another way the current will return back to the machine. That I will be explaining detail in upcoming slides. Now just have, this is the basic idea of how does the ESU machine is operating. Okay, so next I'm going to tell what is the technique that is using bipolar monopolar. Let's as I discussed before, in monopolar technique, here we are using the two electrodes. One is like active electrode, another one is patient return electrode, right? So this is the flow or the current part, the way the current is flowing and return back into the machine. So just note it down. We are starting from generator, because this is here acting as the ESU unit. From the generator the current is passing through the active electrode. This one is active electrode. Current is passing through the active electrode into the body where you want to do the operation like cutting or coagulation. And then you have another electrode, that is patient electrode, that we will be set back side of your patient body, or you can also place it where the more body tissue, body moss is there. Okay, so because that is the area, you can have your you can create a least resistant path. We can easily like collect all current which is being distributed in the body and return it back to the machine. So the monopolar technique, the current flows in the order like from generator, then it goes to active electrode, then patient, and patient return electrode, and finally the generator. The loop is getting closed. This is for monopolar technique. And then the frequency which is used typically in the range of 0.5 to 3 hertz for a monopolar technique. And where you can use this particular sort of application, technique, that is monopolar technique, is that urological application, because there is the that is the area where we have to treat with, when interact with water. Okay, like because if you see the bladder, there will be contains the urine, that is the water. So we have to use this sort of a monopolar technique in order to do any sort of surgery in that particular area, that is urological applications. So next one is bipolar technique. So if you see here, this is the type of electrodes we use in bipolar technique, that is the bipolar electrode. In single electrode you have your two sides. One will act as the active, another one is act as a reference. So this is the reason there is no need of for reference electrode, because in bipolar, in one way the current will flow from the generator, and then it will interact with skin, and again it goes back to the other side of the electrode, then return back to the machine. So this is the way. Okay, so here the current is traveled between the tips, electrode tips. So one electrode tips to tissue, and from the tissue into the another electrode tip. So the it will cover the loop in this way. Okay, so then if you see the current path here, you can see that from generator, and then it goes to active electrode, and then it goes to electrode tips, again it return back to the generator. So this is how the loop is getting closed in bipolar technique. So whatever technique we are using, we should ensure that whether loop is getting closed or not, because if it is not get closed, then the patient skin or tissue will get up burnout, or it will end up with very adverse side effects, like even it may also cause death. So that is the reason we have to ensure whatever technique we are using, the loop is getting closed. Okay, so again here also you can use the frequency range like 0.5 to 3 megahertz. So this particular bipolar systems allows the current flows only between the tips, that is the between the tips of electrodes. This special electrodes which is used in bipolar technique, it is in the form of four shapes, like you have a two projection, one for one side for current flow into the body, another side is another side will collect the current from the body. So that type of electrode is called four shapes electrode. So next we will see the important unit which is there in electrosurgical machine, and other components what are they being involved in electrosurgical machine in next class. So thank you.